Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
How to deal with breast pain after stopping breastfeeding. Stopping breastfeeding is a psychological and physical challenge for both the mother and the baby. Sudden weaning can lead to problems like plugged ducts, engorgement, and mastitis. Common reasons for stopping breastfeeding. 1. Sore or painful breasts. First-timers find breastfeeding uncomfortable and suffer from cracked nipples and painful breasts. This pain makes them stop breastfeeding. 2. Not enough milk. Some mothers worry that the milk they're producing isn't enough for their baby's needs. So, they put their babies on formula milk. 3. Grown-up baby. When the babies reach the milestone of 6 months, moms may want to introduce them to solid foods. 4. Career. New moms who have to rejoin work immediately after childbirth may have no option but to stop breastfeeding. Symptoms that accompany breast pain after weaning. 1. Pain in the areolas. 2. Recurring pain in either or both the breasts. 3. Acute pain in the initial days of weaning. 4. Enlarged, lumpy or hard breasts. 5. Heaviness or tightness in the breasts. 6. Red nipples. 7. Milk leaking from the nipples due to friction. 8. Flu-like symptoms. How long does breast pain last after discontinuing breastfeeding? Breast pain can last for several days or weeks. Most women experience severe pain during the initial days of weaning. The pain reduces or disappears with time. Remedies for breast pain after stopping breastfeeding. 1. A hot compress can give relief from pain. 2. Taking a warm shower or soaking yourself in a tub of warm water can help. 3. You can use a breast pump if your breasts feel too full. 4. You can massage your breast gently while taking a warm shower. 5. You can apply ice packs to the breasts to reduce swelling and pain. 6. Drink water and increase your intake of fluids to prevent dehydration and fever. Tips to stop breastfeeding without pain. 1. Reduce the number of breastfeeding sessions per day slowly. 2. Pump out the milk from your breasts until the discomfort reduces. 3. Opt for a nursing bra that provides adequate support and comfort. Be patient while trying to wean your child as it takes time and considerable effort by both.